This presentation will look to explore and explain the erector spinae muscle along with the role it has in a person while they are walking. The erector spinae is comprised of three groups of muscles, the iliocostalis, the spinalis, and the longissimus muscle, with the spinalis lying most medial, the longissimus lying intermedial, and the iliocostalis lying most lateral. Each of these muscles groups can further be broken down into three specific muscles relating to their region of the spine. There are four regions including capitis, cervicis, thoracis, and lumborum. These muscles each have several origins, starting at the sacrum and the ribs and each vertebrae. These muscles then insert onto the ribs, cervical, and thoracic vertebrae, the skull, mastoid process, and occipital bone. The erector spinae predominantly consists of large, slow oxidative fibers known as type 1 fibers, as well as smaller proportion of fast glycotic type 2 fibers. This fits their role as a postural muscle, as the type 1 fibers have greater endurance as opposed to type 2. This is primarily due to type 1 fibers utilizing aerobic respiration, resulting in a slow release of energy over a long period of time. Alternatively, type 2 fibers employ anaerobic respiration, resulting in a much faster release of power. The erector spinae muscles are innervated by the dorsal rami of the first cervical nerve, up to and including the fifth lumbar nerve. The origins and insertions of the erector spinae muscle dictate the functions of the muscles. The functions of these muscles include back extension, neck extension, lateral spinal flexion, rotation of the head, and maintenance of the correct spinal posture. Contraction of the erector spinae muscles commence when a motor nerve stimulates an action potential to pass down its axon to the neuromuscular junction. The action potential causes the nerve to release calcium ions, which in turn triggers the release of acetylcholine into the synaptic cleft, which then binds the receptor to the sarcolemma. This binding event triggers the opening of sodium channels in the sarcolemma. The sudden rush of sodium across the sarcolemma causes the cell to depolarize and an action potential propagates along the sarcolemma and down the T-tubules. This action potential signals the release of calcium ions from the sarcoplasmic reticulum which flow into the sarcomeres. These bind to troponin, causing it to change shape, which removes the blocking action of tropomyosin on actin binding sites, thus allowing myosin heads to attach, forming a cross bridge. Once attached, a molecule of ATP binds to the myosin head. Hydrolysis of ATP occurs, which leaves ADP and phosphate bound to the myosin head. The phosphate molecule is then released from the myosin head, which initiates the power stroke, whereby the myosin head rotate and in doing so pull the actin myofilaments towards the center of the sarcomere. At the end of the power stroke, myosin releases the remaining ADP molecule and forms a cross bridge with actin and awaits the introduction of another molecule of ATP to begin the cycle again. Once the action potential ceases, calcium is removed from the cytoplasm and troponin reconfigures, which allows tropomyosin to block the active sites on actin. The erector spinae muscles then resume their relaxed state. A patient's gait can be broken down into two main sections: the stance phase, which involves the striking of the heel, the weight bearing, and the toe off, and contributes to around 60% of the gait cycle, and the swing phase, which involves the lifting and the swing of the leg and contributes to around 40% of the gait cycle. A study conducted by White and McNair suggests that in preparation for the imbalances caused by the swing phase, the erector spinae muscles will contract bilaterally to stabilize the pelvis and torso. This means that while the right side of the body is in the stance phase of gait, the erector spinae muscle group will concentrically contract. Simultaneously, the left erector spinae group will eccentrically contract to allow the left side of the body to complete the swing phase.